All right. So the subtitle is the thing I think that matters the most here. If we understand what causes addiction, we actually have a chance at curing addiction, right? And all the other compulsive behaviors that we look at. When we thought that cholera was caused by a giant skeleton walking around wearing a ghost sheet with that dark miasma cloud around his head, how effective were we at curing cholera? You either died from it or you didn't, right? You got the worst case of runs of your life and then you hoped you survived it, right? How effective are we at treating addiction when we think addiction is caused by all these things like moral character problems and stupidity and rebellion, and he's just not afraid enough, we just need to put him in jail and disconnect him from society and destroy the rest of his life so he can never get a job again. That'll make him less addicted, right? If he's got an infection, let's just inject more bacteria into him. That'll fix the infection, right? So we've been doing that all this time. But if we actually understand what causes it, we might have a cure. Okay? So step one about fixing addiction is stop trying to fix addiction. If you go into your doctor and he diagnoses you with a cough and you walk out with nothing but cough medicine and you have pneumonia, is he making it better or worse? Worse. That cough was actually helping you clear it out a little bit, right? Giving someone with pneumonia cough medicine is actually, in my opinion, malpractice if you give it alone. What do you want? Antibiotics, right? So trying to treat addiction by treating addiction is like trying to treat a pneumonia by treating a cough. Pay attention to the cause, okay? So number one, stop gluing leaves back on the tree. It won't bring the tree back to life, okay? Next one. Understanding addiction. So I sometimes when I give this lecture, I'll get people to walk up and they'll say, okay, what do I do next? And I'll say, you just did it. And they'll be like, no, I just want something I can do right now. I'm like, you just did. By far, the most important thing you can do about addiction. Because if you get addiction on a deep level, you will naturally act appropriately, right? When a kid's misbehaving, if you think he's misbehaving because he just needs to be beaten, you're going to act very differently than if you think a kid's misbehaving because he's terrified because last time this happened, his mom was taken away. Right? When you get addiction, you will naturally behave differently. So what you're doing, the biggest step of addiction, of fighting addiction in our society is that. Doing what you're doing. All right, number two, stop following Anslinger. Have I said that enough times tonight? I don't like this guy. Just everything he taught you, throw it out, okay? Everything you learned in school that was Anslinger propaganda, chuck it. We don't have to be part of the Nazi party just because it was big when we were young. I really suspect that, and I hate to say it this way, but some people can grab onto this and they can do it. They can say, my biases are suspect. I think I was wrong. Other people can't do it. They literally can't question themselves. They're going to walk out of here and they're going to nod their head a bunch of times while we talk, and then they're going to walk out of here and be like, boy, I got to beat that out of him. We'll get rid of this. Teach him. It's got to be harder, right? And I just think those people, they're just going to have to die off. We can't change them. So I think there's a generation that got so indoctrinated by Anslingerism that we just, I hate to say it, but there's some people we ain't going to convince them otherwise. So hopefully we can get most of us, okay? I don't think this has to do with age, but some of us that are older got a really heavy dose of Anslinger propaganda when we were young. Did you? All right, so just leave him. Just leave the cult, okay? Next thing, take an honest look at you. We all look at addicts and we're going, no, I'll admit, addicts they're kind of a nightmare. They don't make their families and friends' lives easy. Addiction is really rough. They hurt people. They hurt themselves. And we all have something we do that's an addiction analog, right? We hurt people. But I'm going to encourage you to stop looking at what addicts are doing that could be changed and start looking at what am I doing that can be changed. Okay? And just change all your biases. Change your point of view. Stop being, this is actually a lady by the name of Mary, I always forget it, Dyer, thank you. She made a huge mistake. She did, a few hundred years ago, what is the equivalent of addiction in our society. She broke the rules of society, the cardinal rules of society. And everyone in society at her point, when she was alive, about 300 years ago, knew that you had to fix this. This has to stop now. We are stamping out this behavior. Do you know what her sins were? She left the Puritan church and joined the Quakers. That's evil, guys. That's as evil to them as heroin is to you. And she did something that was almost as bad. She gave birth to a baby with a birth defect. Clear evidence that Lucifer was active in her life and in her womb. Of course, we had to take care of this, right? We don't allow this kind of behavior in our society, so we murdered her. We hung her from a tree, and Mary died. There are rules that are just as stupid and just as arbitrary today that you and I should be able to find our face in that crowd right there. Because we believe it. We're going with it. In some way or another, I promise you, everyone in this room, including me, is in that crowd for somebody. Okay? The next one. Fear has no place in addiction recovery. I always tell patients, guilt has no place in diabetes. That's just not one of the treatments for diabetes, okay? We're just going to take guilt out of it. It makes it worse in the long term. You win in the short term, and then it gets worse in the long term. Fear has no place in addiction recovery because fear is the problem, okay? So looking down on people, this is what Ray Stevens referred to as Sister Bertha better than you. You remember her from church? That social fear that we create, trying to make people better, has short-term gain, long-term loss. Can I point something out? Why is addiction stupid? No, I've been telling you the whole night it makes sense. Why do we get frustrated with the addicts? Because they're using a temporary solution that makes things worse in the long term, right? How do we try to fix addiction in America? With a temporary solution that makes things worse in the long term. We act like addicts to try to fix addiction. Harry Anslinger's fix for addiction was act like an addict and do the same things they're doing, and maybe that'll work. And then the last one is stop horribleizing. The girl with the zit is horribleizing. Okay, so if you had to pick what drug is the most dangerous drug on the planet, which drug would you pick? Before you came in today, food probably is. They didn't do that in this study. They didn't look at that one. Okay, so drug number 2 is heroin. Now, the light blue part of the graph here is how much harm they do to society when they take this drug. The dark blue part of the graph is how much harm they do to themselves when they take this drug. So total harm is how much I hurt society plus how much I hurt me. Drug number 2 is heroin. For those of you that can't see this. Drug number 3 is crack. Drug number 4 is meth. Cocaine. Tobacco's clear down here. I skipped drug number 1. What's drug number 1? Alcohol. We picked the wrong devil drug, guys. The drug that... So let's check and see if you're a horribilizer. Ready? We're going to do a self-exam here. Are you a horribilizer when it comes to drugs? You have a child who comes up to you and says, Mom, Dad, I'm having trouble with alcohol. I've been drinking like every other weekend, and I drink a lot when I do it, and I don't seem to be able to control it. How freaked out are you? How about if a kid says it a little milder? I sometimes drink with my friends. How freaked out are you feeling right now? I sometimes drink with my friends. Now, let's use drug number, 4. Mom, Dad, Sometimes I use meth with my friends. Which one freaked you out worse? Wait, meth isn't even in the ballpark. 35 compared to 72, it's half as dangerous as alcohol to your child and to everyone around. Why did you freak out about meth? That's the emotional side of it. Okay? Now, there is something that validates that a little bit more than I'm saying, and that is it's easier to go to jail over meth, right? And that's a big deal. But as far as how dangerous is this drug, if you picked a stronger response to meth, that's what Anslinger was trying to do. He was trying to get you to freak inappropriately. Now, am I a fan of meth? No, I am not telling you guys it's okay to take drugs, okay? But I am saying we got to take a different look at this, okay? Avoid extreme correction tactics. Again, fear and stuff like that. This is something, and I won't spend a lot of time on this, but there's a punishment spectrum. And it goes from, I actually incite the bad behavior, to I just allow natural consequences, I'm neutral, I don't do anything, to I torture the person for the bad behavior. And most healthy responses tend to be somewhere in the middle. If you plot out your responses on how you handle your kids over time, it should look like a bell curve. Most of the time, you should be closer to the center. So if my kid runs out in the street all the time, I have a problem with the toddler who runs out in the street, allowing natural consequences might not be the best option, right? But look at this. If I'm over here, what am I doing to the toddler who runs out in the street if I get to this end of the spectrum? I'm chasing him out into the street. You know, I'm pushing him in the street, right? Is that good parenting? What if I'm over here? What this could look like in an extreme case is you're never going out in the street again. I'm going to fix this problem through fear. So I take this kid, and an extreme example of this, and this is extreme, I understand. The kid starts heading for the street, and I take a baseball bat and beat this child to within an inch of their lives. That's persecution. The solution was worse than the actual threat. Right? The kid maybe would have gotten killed and injured by a car. They for sure got injured by me. You see how that can be? And this actually should be a loop. It shouldn't be a line. Persecute should loop around and touch incite. They should actually go like this. The closer you get to persecuting someone, the more you cause the behavior. So overreaction in punishment, you become an inciter of that behavior. We have caused addiction in the United States. Harry Anslinger, the places that instituted his policies the best saw an increase in drug use. And do you know how he explained that? It's the communists. He actually started a communist scare at that point because the science was really looking bad for him. So he came out with, the communists are doing this. My method actually works. He promised he'd get rid of drug use in 20 years in the United States. And then when it got worse, we started a red scare. So treat the actual cause. Stop treating this guy, start treating these guys. Okay? That actually is cholera, by the way. Don't find out. Try to stay away from as many things as you can. Don't try it, and you'll never know. This is the center, and we need to do a whole huge conference on this. This is where psychology is going, and rightfully so. Resilience is everything. We're actually raising a generation that is less resilient than I think any generation that's lived. And the reason is we are taking more out of these kids' accounts than we're investing in their accounts. Kids are less connected. Remember, connection is the currency of the brain. It's the money that the brain uses. We are withdrawing faster than we are investing. As the world's gotten crazier and both parents are out of the home, and you can't connect with your friends because the only way to connect is on social media and electronic devices, which is a false form of connection, right? And there's a whole conference we can do on that, too. These kids don't have options. As parenting techniques have gotten kind of pop psych and goofy, these kids aren't getting as much connection, as much attachment. And as a result, we're spending money we haven't invested. And these children are becoming brittle. And I think as long as we head this direction, I predict there will be more school shootings, more suicide, and more addiction until we can learn to build resilience by investing in these kids' connection bank account. So I don't think we're getting close to the end of this, guys. We're going to have to go in further. Connection, I mean, that's the center of this whole thing. Use limbic therapies. So the therapy that we love in the world of psychology is vitamin CBT. You guys have all heard of cognitive behavioral therapy, right? We think it fixes everything. It's a prefrontal therapy. I would say if you give someone a prefrontal therapy like cognitive behavioral therapy, you should expect about a 10 to 20% decrease in symptoms. If you do a limbic therapy like EMDR or internal family systems therapy, I would say you should expect, and this is just me talking, what I see in my patients is I would say expect somewhere between a 40 and 80% reduction in symptoms if it's done well. So use therapies that actually target the part of the brain that's having trouble. All right, and change the way, so what you should be looking at when you see this guy who's making some bad decisions and end up in a bad spot is instead of asking what we've been taught to ask, what is wrong with you? We move to a new paradigm where we ask, what happened? Because there's a story. So this is the definition, I'm almost done here. This is the definition that the government gives of addiction. Everything that I have problems with, I highlighted in red. So here's their definition. Addiction is defined. I have a problem with that. I don't think they've defined addiction. I don't even think they know what it is. Number 2, as a chronic relapsing brain disease. Relapsing, you can't relapse if you've never been cured. If somebody has cancer and I don't treat their cancer, they will not have a cancer relapse. They will have a continuation of cancer. It's not a relapsing disease. We don't fix it, okay? It's not a disease. It's a symptom, right? And I really have a problem with that. According to them, this is the whole reason I brought up the DSM-5 earlier, you can only be addicted to drugs. They finally in the DSM-5 said, oh, and gambling. So if you're addicted to anything that's not a drug or gambling, you're making it up. That's the only ones they allow right now. I think this shows a major problem. If you go on to the CDC or the drugabuse.gov, this is the current definition that our government is using. And this comes from about 1930 ideology. All right, here's all the myths. If you can read that, pick the one that is the most believable to you. These are the stories that we've told ourselves. One of the reasons we tell stories about addicts is it makes us feel safe, by the way. If he's just morally corrupt and I know I'm a good guy, I'm not at risk for getting addicted. I am safe, right? So this is actually another type of bias. It's called the just world bias. And it makes us feel safe. It gives us a false sense of safety. Now, here are the things that addiction is, okay? These are the things I hope you've learned. It is a symptom. It is predictable. We know why it happens, and so we know when it's going to happen and to whom. It happens to good people. It actually makes sense. It is usually not drug-related. Contrary to what we just read, it's usually a different behavior that doesn't have any drugs in it, but a lot of drug addiction too. We see that all the time, don't we? It is fixable. And it is a normal response to an abnormal situation. This is not a broken brain or a bad person. This is a normal response, okay? So here's the test. This is the final test at the end, and I am going to lose some of you because this is high end. Like, this is going to test if you really have internalized this, and some of you are going to like, nope, okay? How do you feel about this kid right here, this guy right here, who has cerebral palsy, and if he made your life difficult, if this were your child, and he was demanding a ton of your time and effort, and making your life miserable, and costing you tons of money, how do you feel toward him versus if this is your child? Now, I hear brains all through this auditorium going, not the same! He can't help it! Wait. This happens because the patient likely while being delivered, didn't get enough blood and oxygen to his brain. This happens most commonly. Now, there are different things that cause this too. But most commonly, this guy's happened because he didn't get the attachment. He had an attachment deficit, usually sometime quite early. That's the most common cause. Who's at fault? Who's the bad guy? If you can get your brain away from this good guy, bad guy, blame, fault thing, that is the lie that we've been taught. Do we have fault? Yes, there is fault. I believe in fault like crazy, but I believe there's only two people that use the word fault: gods and fools. Because if you aren't a god, you trying to figure out fault is impossible. The things that can cause addiction are things that you think are totally benign. The traumas that will scare the brain are things that happen. And there's the ACE study that has 10 things that can injure you. It's a beautiful study. It's gorgeous, the Adverse Childhood Experiences study. Those 10 things, I would say, aren't even half of the things that scare children's brains and adults' brains. And they're not even the most potent ones. So we're missing most of the things that cause addiction. So if you kind of have a real different feeling for this guy than you do for this guy, keep working. I think that's the test right there. If you feel like, oh, sorry, man, what can I do to help? Even if it's kind of hard. No, I'm not going to let you abuse me, but what can I do to help? Then I think you're getting there, okay? All right, now you know why. Does this make sense now? Now the last slide here. We've got a dark history. We have been walking down a very dark corridor when it comes to addiction treatment. We put our injured people in cages. That's how we help our injured people. We cage them. We torture them. Okay? I don't think it has to end there. I think we can not only create a light at the end of the tunnel, I think you and I can create a life at the end of this tunnel. Someone who has used heroin for years doesn't have to have a criminal record that destroys them for decades to come. Someone who hurts us because they're addicted and steals stuff from us, we don't have to retaliate with a fist to their head. We do protect ourselves. We do try to minimize the damage they do, but we don't have to stay here. I think we can move on to here. And I guess that's what I'm asking tonight. Thanks, guys.